The Hunterdon Medical Center is a community hospital. Actually, we're the only hospital in idyllic Hunterdon County, New Jersey. Our 178-bed teaching hospital has served as a national model for community-based family medicine and preventative health care since 1953.
Hunterdon Medical Center is beyond a good hospital. It's a great hospital, and increasingly the data is proving that.
The Hunterdon Medical Center has made a commitment to become, within the next 5 years, a national model for community health care.
I think having a good community hospital matters to all of us. It should matter to all of us. All of us are going to be patients at one point in our lives, and it's imperative that we have a first-class healthcare delivery system available to all of us in the county.
I chose Hunterdon Medical Center to practice because I wanted to live in a community like Hunterdon County that had a great quality of life, that had schools, parks, and a community that I could raise my children in.
I can't emphasize enough that we chose to be here, not because we couldn't have a role at a university hospital. We chose to be here because this is the place to live.
So for almost 60 years, we have known what people are just now discovering. You need a seamless team of medical experts and healthcare professionals focused on a patient throughout life stages and across the continuum of care.
In our emergency department, we treat patients the way we'd want to be treated. We treat them just like family members or ourselves if we were in a crisis situation. And if you treat your family members or treat people the way you want to be treated, you're always going to do the right thing.
The Hunterdon Regional Cancer Center is important to the community because it provides the patients in our community access to state-of-the-art cancer treatment right in their own backyard.
Unfortunately, after 20 years of being here, I still find that people are unaware of what we offer, and that is true 24/7, seasoned, professional, attending, intensivist care at any time of the day and night, in particular in the middle of the night.
If your husband is brought into the emergency room with a heart attack, that he'll make it from the doors of the emergency room to the door of the cardiac catheterization lab faster here than in 99% of the hospitals in the state of New Jersey and faster than 90% of the hospitals in the United States.
You know, people are labor under the misconception that bigger is better, bigger hospitals are better than smaller hospitals, and I'd like to really dispel that notion. For instance, in Hunterdon Medical Center, we have I believe, either the first or second highest percentage of board-certified physicians in the entire state of New Jersey. And that is much better than the larger institutions, and that really kind of puts the stamp of quality on the healthcare delivery that we're offering to people in this county.
What makes Hunterdon Medical Center's cardiovascular program unique is its ability to deliver some of the highest technologically advanced care, carotid stenting, primary angioplasty, in a setting that's essentially what we call high touch, the ability to have nurses who know your name, to have nurses that follow you through the entire hospitalization here at the medical center.
Perhaps that's why we're written about in textbooks, lauded by experts, and studied as the model of what modern healthcare should look like. Today, Hunterdon Healthcare plans to strengthen its environment of care with a new way of programmatic needs and 21st century technology in response to our growing community's needs.
We know that today's emphasis on technology seems to be an either-or choice. The either being you're highly technologically advanced and you lose the personal connection with the consumer when they become a patient. Or you have a very personal touch, but somehow you've fallen behind in advanced technology. What Hunterdon has been able to do is to balance both. So our addition of technology to our repertoire of services is really an enhancement of the way in which we understand the consumer and what they need.
Now more than ever, we need private support. We need your help. In challenging times, philanthropic giving becomes a key element in the financial health of every hospital.
Giving is very important. It's essential to making sure that we have the best of care here in Hunterdon County.
We need to grow. We will not accept stagnation. The capital campaign is absolutely critical to this growth, and to provide for the community the state-of-the-art medical care that they expect and that they need.
People should give to the capital campaign to help the Hunterdon Regional Cancer Center because it allows us to purchase new equipment that keeps us on the cutting edge.
Without the capital that we seek with this campaign, expansion of the different programs that are targeted will not be possible.
If you don't give to the capital campaign, we can't accomplish our initiatives. There is a gap between the money we have and the money we need. And the only way to make that bridge is to have people help us raise money. So without the community, without people like you, we can't get there. Our immediate needs include the expansion of Hunterdon Regional Cancer Center, enhancement of surgical services, and continuing our cardiovascular excellence. There's a reason we want to continue Hunterdon Medical Center's position as the premier community healthcare provider in the region, and that reason is you. You, your family, your co-workers, your friends, everyone whose lives are touched by the outstanding physicians who practice cutting-edge medicine here in our community every day.
This is my hospital.
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 This is my hospital. This is your hospital.